You ready? All right. Well, good afternoon. We'll get started on 10/20/20, October the 10th, 2020. We want to continue to bring you information and keep you apprised of all of the activity we have in our COVID, and today there'll be some additional information. I think you look forward to that. As you know, we got an election coming up, and Kara Sands, I understand, will be here to give us some information about how to do that and keep safe at the same time. Annette Rodriguez will be following me to give you the report on the activity and the statistics, as well as some comments the city manager sometimes makes. He's out today at another appointment. But let me just encourage you to not let our guard down. As I look around and I see news reports of what's happening over the country, it appears that some states are experiencing some significant increases. And I think some of that is due to bars opening back up, but we're also doing something about other businesses opening up, expanding the amount of capacity in our restaurants and other things. And so please don't let your guard down. Continue to go through the protocols that we ask. We can't afford to let our enthusiasm override our good judgment in protecting ourselves. We certainly don't want to see significant increases anytime in the future. We want to see them going down. And so your participation is vital to that. And for those of you that really want to do something to save some money, I think it would be significant if you would do that, in that because the bars are opening and others, the counties and the cities agreed with the governor that we could do that on the basis that we enforce the rules in terms of the masks and the quotas inside in the bars and restaurants. And so enforcement costs money, and so you can save yourself some tax money by not having to have the enforcement as strict as maybe it could if we knew that everybody was in compliance. So it's a double win there. You save tax money as well as you stay safe. So I would at this time like to introduce Annette Rodriguez, Public Health Director, to come and share the information that she has for you. And then Judge Canales is here to share some things with you. And then the other folks will come and give you more information. And please pay particular attention to Kara Sands, is what she tells you about voting and how to do it safely. We want everybody to have an opportunity to vote. I think it's important. And numbers looking good so far from what we're seeing, and I'm encouraged by that, but we don't want anybody to get discouraged because they see us going uphill instead of downhill on our statistics on COVID. So stay safe, follow the protocols, and listen to Annette Rodriguez. Thank you, Annette.
El día de hoy nos va a acompañar la directora del Distrito de Salud, la juez del condado y la secretaria del condado para hablar sobre las medidas de seguridad que se llevan a cabo al momento de votar. También tendremos el reporte de la Universidad Texas A&M. Aparentemente, algunos estados han estado viendo un aumento en los casos positivos. Le pedimos que no baje la guardia, protéjase en contra del virus. Todo depende de su colaboración. Los restaurantes y bares también comenzaron a reabrir siempre y cuando se lleven a cabo los protocolos. Ahora la directora del Distrito de Salud, Annette Rodriguez, nos va a dar su reporte.
Good afternoon, Annette Rodriguez, Corpus Christi, Nueces County Public Health Director. I'm going to start out first with the statistics. City Manager Zanoni sends his regrets he could not be here today. So we're going to start out by looking at the last 2 weeks of cases. And so if you look at the last 3 days, we went from 11 cases to 12 cases to 19 cases today. So if you look at October the 10th, we had 2 cases on that day, 2 positive COVID cases. On the 11th, we had 7, and on the 14th, we had 6. So we were really pushing for single-digit number of cases. but it looks like we're at double digits now, and so we really need your help to make sure to help keep our COVID numbers down as far as we can while we're in seasonal flu in October. Next slide, please. So this is the donut diagram, and it basically shows you that we have 20,298 people recovered, which is great news. We just hit over 21,000 cases as of yesterday. So it's good to have recovered cases, but we also know that we still have active cases. So we have a total of 291 people in Nueces County with active COVID-19 that still have the potential to spread that virus to other individuals if they're out in the community, which they shouldn't be. They should be in isolation, but also to family members. So we need to watch these numbers very carefully. Next slide, please. The hospitalization numbers, while we see October 7th, they were in their 70s, and now they're in their 60s, we still see that it's a very gradual decline. It's more of a plateau at this point. And so the last 6 days, we've been in the 60s, 68, 63, 63, 62, 60, and 62 again today. Next slide, please. These are the ICU patients, and so we're at 21 today, the same as yesterday, 21 individuals in the ICU. We all know that people in the ICU are requiring a lot more assistance than just a regular floor. Some will even require being on a ventilator. So we pray that these individuals will do well, recover completely, and will leave the hospital soon. Next slide. These are our total COVID-19 deaths. This is a cumulative number for Nueces County. So 438 cases with the death that we had today. And our condolences do go out to the family that lost their loved one to COVID-19. Excuse me. And finally, the last slide, next slide. This is the cases from the beginning back in May, and so we had cases earlier, but you're still going to see the flat line at the bottom, the red line, and you can see it takes that bell-shaped curve. The 7-day average for cases is still, excuse me, is still 23. And then the daily count is in the blue. Sorry, I have a tickle in my throat. Next slide. Thank you. And this is just a cumulative of the cases with the state, what we call the data dump, and you see those numbers on top of the blue bar graphs, and so for the total number of cases, which is over 21,000 as of today. So I'm going to switch hats a little bit, and I'm going to go to some of the points from the Public Health District. So the Health District's next drive-through is scheduled for tomorrow, 1702 Horn Road at the Health District. If you're experiencing COVID-19 symptoms, you can self-register online at www.cctexas.com/coronavirus. Under recent updates, you can click on the register for drive-through link. Or you can always call the hotline at 361-826-7200, and we can help you to register as well. We're also having a drive-through for seasonal flu. So if you haven't received your flu shot yet, you can get your flu shot this Thursday, again at the Health District. That's from 8:30 in the morning to 1:30 p.m. We're encouraging, like CDC, everyone ages 6 months and older to get vaccinated against seasonal flu. You can call 361-826-1303 to get registered. The cost is $10 cash at the drive-thru. For any COVID-19 positive patients, our COVID-19 outpatient clinic is still open Monday through Friday from 8 to 5. COVID-19 patients are encouraged to call the 361-826-8255 8019. If you have questions regarding your health after you've experienced COVID-19, this service is available for both insured and uninsured patients. We all know COVID-19 is still spreading in our community. One of the ways of slowing down the transmission is by the quarantine method. Quarantine is used to keep someone who was exposed to a COVID-19 positive person away from others. This helps prevent COVID-19 from spreading before a person knows they are sick or they are infected with the virus without experiencing those symptoms. If you have been exposed to someone who is COVID-19 positive, self-quarantine immediately for 14 days. If any member of a household is COVID-19 positive, all members of the household must quarantine for 14 days. If any members of the household are school-aged children, they must go back to virtual learning until the 14-day quarantine period is completed. A negative test within the 14-day quarantine period does not release an individual from quarantine. So just because you have a negative on day 7, that doesn't mean you can go back to face-to-face instruction. You still have to stay home for the rest of the quarantine period. We must all work together to mitigate COVID-19 in our community. We understand about pandemic fatigue, but we're asking everyone to keep up the good work and keep practicing the public health strategies that we have given you. Now let's talk a little bit about Halloween. Halloween, like all our previous celebrations, should be altered to reduce the risk of contracting or spreading the virus. Public health asks that you actually stay home this Halloween and not go out. Please consider the risk when planning or attending Halloween activities. And as you can see on the screen, I'm going to start from the bottom and go up. So the lower risk activities are the activities that we want you to focus on if you feel like you have to do something this Halloween. And those are going to involve carving or decorating pumpkins with your family and displaying them. You can also have a virtual Halloween costume contest. You can have decorating pumpkins with your family members or a Halloween night. The moderate risk activities are small group outdoor open air parades with social distancing, trick-or-treating where goodie bags are lined up so they can just grab them and go, Halloween celebrations outside with small groups of neighbors is in the moderate risk, and also outdoor Halloween movie night with family and friends social distance is still in the moderate risk. For those in the higher risk activities, that's the top one, it's going to look just like the traditional Halloween. The traditional trick-or-treating where treats are handed to children who go door to door, or trunk or treat where treats are handed out from the trunks of cars, or attending crowded costume parties indoors or crowded Halloween festivities. So any of those activities just mentioned are considered high-risk activities for picking up COVID-19. So again, the Health District would like to remind everyone if you're sick, in isolation, or in quarantine, do not participate in any of the in-person activities. We want everyone to have a safe Halloween, stay at home this year if possible. We must all work together to mitigate COVID-19 in our community. We understand pandemic fatigue is setting in, but we're asking everyone to keep up the good work and keep practicing the 3 W's, which are watching your distance, wearing your mask, washing your hands. Stay safe, stay upbeat, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 19 casos confirmados por el coronavirus, más 3 casos por parte del Estado, casos no recientes. 20.298 pacientes se han recuperado por completo, 62 continúan en el hospital, 21 personas están en la unidad de cuidados intensivos, 291 son casos aún activos. Hoy se reporta un fallecimiento. A la fecha los fallecimientos totalizan 438 personas. El promedio de casos positivos en la última semana es de 23. La próxima toma de especímenes del Distrito de Salud será el día de mañana en el 1702 de la calle Horn, en el Distrito de Salud. Si tiene síntomas por COVID, puede registrarse en línea en la dirección www.cctexas.com/coronavirus o puede llamar al 361-826-7200. También tendremos una clínica móvil de vacunación contra la gripe este jueves de 8:30 a 1:30. Exhortamos a todos los residentes mayores de 6 meses de edad a vacunarse. Puede llamar al 826-1303 para registrarse. El costo es de $10 en efectivo. Para cualquier paciente con el virus, nuestra clínica ambulatoria está abierta de lunes a viernes de 8 a 5. Se recomienda a los pacientes llamen al 826-8019 si tiene preguntas sobre su salud. El COVID-19 todavía se está propagando en nuestra comunidad. Una de las formas de disminuir su transmisión es mediante el método de cuarentena. La cuarentena se usa para mantener alejado de los demás a una persona que estuvo expuesta a una persona con el virus. Si ha estado expuesto a alguien positivo al virus, pónganse en cuarentena inmediatamente durante 14 días. Si algún miembro de un hogar es positivo para el COVID-19, todos los miembros del hogar deben estar en cuarentena durante 14 días. Si alguno de los miembros del hogar es un niño en edad escolar, debe volver al aprendizaje virtual hasta que se complete el periodo de cuarentena de 14 días. Para la celebración del Día de Brujas, debe de modificarse para reducir el riesgo de contraer o propagar el virus. Tenga en cuenta los riesgos al planificar o asistir a las actividades de Halloween. Algunas de las actividades de menor riesgo es la de esculpir calabazas con la familia y exhibirlas. Algunas de riesgo moderado es estar en desfile de grupos pequeños al aire libre con distanciamiento social, pero las actividades de mayor riesgo es pedir dulces de manera tradicional de puerta en puerta, pedir o entregar dulces desde la cajuela de un auto o asistir a fiestas de disfraces llenas de gente. Ahora la juez del condado, Bárbara Canales, nos va a dar su reporte.
Good afternoon, everyone. Barbara Canales, Nueces County Judge. Well, today our county clerk, in just a few moments, will be talking about all her office has been doing to ensure safe voting for all of us. And she will go over in detail some of the precautions that they are taking. The procedures, of course, that they've put into place will also be described and what you can do to maintain a safe voting experience. I think this is probably the most important topic of these next few weeks as we go into the last 2 weeks of early voting and finally Election Day on November the 3rd. And so the bottom line is we want all of you to be very safe and secure when you're voting. And the right to vote clearly is a fundamental part of our democracy. And nothing, not even a pandemic, should deter any eligible voter from exercising their right to vote. And going into this, I've been asked so many questions about our COVID-19 response from the emergency management sector. And one of our biggest fears collectively was that some portion of our citizens would choose to stay home rather than risk going out to vote. And so I think that in addition to ensuring that our polling places are safe, we also have an obligation to ensure that our citizens know that our polling places are safe. And like many things in 2020, this is an unbudgeted expense. Fortunately, I'm here today to report that we also have federal funding available through the Help America Vote Act. And they're also private grants that counties were able to apply for this year. And it gives me great pride to say that Nueces County, along with many other Texas counties, applied for and was awarded a grant for $337,000 for the Center for Tech and Civic Life, otherwise known as CTCL. And these grant funds can be used exclusively for public purposes of planning and operationalizing safe and secure election administration. And really, in cooperation with Director Annette Rodriguez, Public Health thinks that this is an incredibly important endeavor. So even though she just left, I want to say thank you to Annette and Public Health because she's really been spearheading this campaign while we have been working on other important endeavors like vaccination plans at the same time. So in accepting these funds, Nueces County has indicated to CTCL that the amount of the grant would be expended on the following specific needs. And with Director Rodriguez's guidance, she has identified those needs. And I could list all of the different opportunities, but Suffice it to say, anything from nonpartisan voter education to personal protective equipment if needed, poll worker recruitment funds, any type of staffing or voting materials in languages other than English, any type of public health messaging around reducing the spread of COVID-19 while we're in our safe voting practices is what these funds would be used for. And so we were allowed under the terms of the grant to use these funds also to obtain the matching grant for that HAVA. So one of the very best things that this private grant is going to do is that there was a $63,000 match for Help America Vote. And now the county does not have to expend those dollars out of county general fund. We can use these grants to help make that matching grant. And that's just a terrific use of the funds. So when you can use grant money to get more grant money, that's what we call a double scoop. It's a win-win, and it's a good day for the county budget. So we're putting these good funds to work, and we hope that you will see them everywhere. You'll see them at all 25 of your voting center, early location voting centers. We hope that you will see these public health messages coming from our city county public health department on TV and on radio in English and in Spanish. And the goal is very simple, that every registered voter not only has the ability to cast their vote safely, but we want them to know in emergency management and city county public health that they have their ability to cast their vote safely and securely. Nonpartisan voter safety information is a big component of that. And you will see, as I said, these signs that are directly behind me at your polling places, reminding you to wear a mask, practice social distancing, and wash your hands. And although the county clerk will inform you that it is not you do not have to wear the mask, from public health's perspective, it's our job, it's our duty to save lives and to encourage this responsible behavior. And so please take a look at our Vote Safe Nueces logo and be proud that your county has joined so many other urban counties throughout the state of Texas in making these announcements and letting people know what they need to do to vote safely. All of us, collectively, behind the Nueces County seal, City of Corpus Christi, and on behalf of all of the small towns within Nueces County, we're all doing our part and everything in our power to ensure that you cast your vote. The most fundamental part of being an American is to appreciate the sacrifices that our men and women in uniform have made for us. It is the best part of the red, white, and blue. And I'm grateful for you, the media, covering this press conference today, and are also helping us share our message to Vote Safe Nueces. And I invite the media to take a look at all of our particular signs, and you'll see these everywhere. We think that whether you want to quickly read them or not, the image speaks for themselves. So thank you to Director Rodriguez, Dr. Dante Gonzalez, and everybody at City County Public Health for putting in the time and effort with our media experts to make sure that we are continuing with the 3 Ws. Thank you, and we will be available to answer your questions at any time.
Hoy nuestra secretaria del condado hablará sobre todo lo que está haciendo su oficina para garantizar su votación segura. El derecho al voto es una parte fundamental de nuestra democracia y nada, ni siquiera una pandemia, debería disuadir a cualquier votante elegible de ejercer su derecho al voto. No quiero que por temor a enfermarse no salga a emitir su voto. Los lugares para llevar a cabo la votación estarán seguros, pero este ha sido un gasto no presupuestado. Afortunadamente contamos con fondos. El condado de Nueces solicitó y recibió un subsidio de $337,000 del Center for Tech and Civic Life. Este fondo va a cubrir, entre otras cosas, buzones de votación, educación de votantes no partidista, equipo de protección personal, personal temporal, materiales de votación en idiomas distintos al inglés, entre otros. También se nos permitió utilizar algunos de los fondos para obtener una segunda subvención. Mi objetivo es que todos los votantes registrados puedan emitir su voto de manera segura. Usted verá letreros en los lugares de votación que le recuerdan que debe usar cubrebocas, practicar el distanciamiento social y lavarse las manos. Ahora la secretaria del condado nos va a dar más información relacionada a las elecciones y el coronavirus.
Hi, I am Kara Sands, your Nueces County Clerk, and I'm also the Chief Election Official for the County of Nueces County. Thank you for having me here today to discuss the very important, what's going on now is voting. Early voting started on October 13th, and it runs through October 30th. And it's important to note that we have had record turnout. We appreciate everyone, all the voters who have come out, who have voted, and who have practiced social distancing, and who have worn masks. I appreciate everyone. We can do it together, and that's what we're doing, to keep everyone safe. I would also, let me say that I'm sorry for everyone that has been affected by COVID, people that have lost loved ones, that have suffered from this terrible virus, and my heart goes out to you, and everyone in my office, our hearts go out to you. And we're all in this together and fighting this together. And we can do this, again, at the polling locations. Luckily for us, we were able to have kind of a dry run, if you will, of what we can do, the best practices to keep you safe. And I want every voter to know that my office and my staff and all the poll workers are doing everything we can to keep you safe at the polls. And this is how, if you remember, in July, we had a runoff, and we had the runoff, it was the peak of our cases. And what we did during that election, we had 0 cases come from that. Now, granted, it was a small election, and 10,000 people came out and voted, but nonetheless, I believe what we put in place what did protect us then, and it is going to protect us now. So what we're doing to keep you safe, and again, that's our #1 priority, keeping your vote safe and keeping you safe, is we have hired extra poll workers, and their main job is to clean the polling locations. They are sanitizing after every voter, they're sanitizing the surfaces, and they're sanitizing the doors. We're also sanitizing the styluses. We have several disposable stylus pens that no voter is going to use the same one. We're not going to cross-contaminate them. They're regularly cleaned, and they're sanitized, and then we'll reuse them. We're also enforcing social distancing, but we need your help to do that. So when you come to the polls, please practice social distancing. As many signs as we have up and markings on the floor, we need you to help us and help your fellow voters and poll workers to also respect the social distancing guidelines. You will use Q-tips. You'll be given a Q-tip after you check in, and you're giving your access code. And you'll use that Q-tip because we have touchscreen voting machines, and you'll use the Q-tip to vote. And that's just another easy way that we can do to keep you safe. All the poll workers will be wearing masks. We've also provided PPE for them. They have face shields that they'll use, and gloves, and sanitizing their hands. There's hand sanitizer at every polling location as well that we provide for you. And things that you can do to help keep everyone safe is wear your mask. We cannot require you to wear a mask, but we just really respectfully ask that you do. If you also use curbside voting, if you're symptomatic, right now the law states that if you have a physical disability to enter the polling location, when doing so would injure yourself or harm others, you can curbside vote. But that's been expanded that if you are COVID positive and you are showing signs of you have symptoms, you can curbside vote. That means that you'll pull up to the polling location and you call 888-0303 and you let us know which polling location you're at, early voting and election day, and we will send the clerks out to you. And they will process you just like you were in line. But keep in mind, this isn't a line skipper. When you get there, you're still going to be in line. But they will bring out the polling equipment to you. It will be sanitized. The workers will be wearing face shields and masks, and you can vote in your car curbside. We want everyone in Nueces County that is registered to vote, we want everyone to be able to cast their ballot safely and securely. And this is another thing that we've provided since 2016. We also have 25 early voting locations that you can go. Any registered voter in Nueces County can go to any one of the early voting locations that they choose. On Election Day, we have 84 locations. And again, what we implemented in 2016 is vote centers. on Election Day on November 3rd, and you registered voter, you can go to any one of the 84 polling locations that you choose, whatever is most convenient for you. We will also be putting out updates, like where the lines are the shortest, so you don't have to wait in line. What you can also do is go vote don't go during the peak hours. The best times to go and vote are 9 to 11 and 2 to 4. Those are not the peak hours, and you're usually not going to have a line. Another thing you can do is go to our website at nuecesco.com and go to the elections. Click on elections. Every day we have the early voting turnout. We have it by location. And you can check this early voting, and you can check the locations and see where the lowest turnout is. And then you can make your plan. While you're on our website, you can print off a sample ballot. And when you print off your sample ballot from our website, you can fill it in with your choices. And once you take that with you to the polling location, and that will also lessen the time that you are in the booth voting, because you can take that out and you'll have your choices with you, and they're already marked. So that saves some time, and it keeps the lines moving as well. You can bring your own stylus pen with you if you would like. But there's just some things that you can do that we can all do to work together. Also, use the hand sanitizer that we provide. And if you see something at a polling location that you think that maybe they're not cleaning fast enough, call me, let me know. I cannot correct a problem if I don't know about it. So I need y'all to let me know. And you can call me at 888-0385. Or if there's something that you think we can do better, I want to hear from you. I work for you. I work for everyone in Nueces County, and you hold me accountable. Let me know what we can do better to serve you. And again, thank you. It's been an honor to serve as your county clerk. And get out and vote. We are protecting you. I assure you, we are doing everything we can to protect you. Thank you.
La votación por adelantado comenzó el 13 de octubre y continúa hasta el día 30. Gracias a todos los que han votado por adelantado. Mis más sinceras condolencias para aquellas personas que han perdido la vida debido al virus. Estamos haciendo lo posible por mantenerlo seguro en las casillas de votación. Parte de lo que estamos haciendo es desinfectando las superficies y puertas. También estamos practicando el distanciamiento social y le pedimos su colaboración. Usted va a recibir un algodón para poder emitir su voto, ya que las pantallas son táctiles. Si usted cuenta con síntomas por el virus o es positivo al virus, usted podrá votar desde su auto, pero antes tiene que llamar al 888-0303 para que un empleado le ayude a emitir su voto. Queremos que todos en el condado emitan su voto de manera segura. Existen 25 ubicaciones para votar por adelantado y 84 lugares el día de la elección. Si puede evitar votar durante la hora pico, también las líneas serán más cortas. La hora pico es especialmente durante la hora de lunch. También puede acudir a la dirección nuecesco.com, ir al lugar de elections para poder ver su boleta de votación con anticipación. Para más información puede a llamar a la oficina de la secretaria del condado al 888-0385. Ahora el equipo especial de la Universidad de Texas A&M va a dar su reporte.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID Task Force. We have two objectives on the task force. Number one is to address public concerns and questions about COVID-19 and the interventions that are taking place to address the pandemic. And two, to help enable evidence-based decision-making on the behalf of our local leaders. There are several interventions and Open Texas rollbacks of interventions that have taken place. You're encouraged to stay home if you can. If you're over 65, you're encouraged to stay home and avoid people that have been out in contact with crowds in the last 14 days. In terms of social distancing and face coverings, we're still hoping that you can maintain social distancing and face coverings, because with the current Open Texas guidelines, this is one of the major combatants that we have to stop the spread of COVID. 3, self-isolate when symptomatic. I don't know how many times I've heard at this point people tell me that they feel sick, but they don't have COVID. And I ask them, how do they know? And they don't, because they didn't get tested and they just don't want to believe that they might have COVID. So if Symptomatic means anything, runny nose, tickle in your throat, that's symptomatic. You contact your doctor, you get tested, and then if you come out clear, then you can end your isolation. School restrictions have been loosening. We've been following this. I think there's some voluntary component of this. If you want your kids to stay at home, they can for the most part. But we're increasing the number of students that are in class. And we've gone through a variety of Open Texas phases. Right now, we're in a solid Open Texas Phase 3. And just to remind you, we were in Open Texas Phase 3 for 1 month before that was shut down because of the outbreak over the summer. So 1 month of Open Texas Phase 3 led to 3 months of Open Texas Phase 1.5 and us trying to get the summer outbreak under control. So right now the transmission rate in the coastal bend is between 0.9 and 1.1. These are estimates from 2 different models. One model that really we haven't changed the parameterization of it for about 2.5, 3 months now. It still is indicating that 0.9 is a really good fit. The other model, which is what you see here with the transmission rate through time, is thinking that or indicating that there's an increase in the transmission rate over the past several weeks. So when the 2 models don't agree, then usually we're somewhere in between, and we've been kind of in a holding pattern, as you saw from Public Health Director Rodriguez's presentation. One more time, a transmission rate of 1 means that COVID is not spreading or declining. It means it's staying the same. So we're right there on that balancing point between declining and increasing. In terms of the number of cases, we're at 23,884 confirmed cases of COVID-19 in the Coastal Bend area. A confirmed case is a case where somebody tests positive with the PCR test, not an antibody test or an antigen test. The reason why we report this number is this is the number that the state is reporting for all the counties, and for us to compare our numbers locally to other counties and public health districts across the state, we need to look at just the confirmed cases. Of those, the vast majority have recovered, 22,880, and there are, we estimate that there's about 304 active cases in the Coastal Bend right now. So the cases are remaining low, and I know maybe a few days ago people started to get nervous seeing a steady ramp up in the cases over the past week to week and a half. So what I did was I provided a longer term view here than 2 weeks. This is a 4-week view. The top line that's in purple is Nueces, and what you can see is that it's been kind of going up and down, but over time more of a gradual downwards or maybe leveling off trend, as opposed to if you just looked in the last week and a half, it would look like it was going up and then curling down very recently. So I don't think this is time to sound any alarms yet. It looks like oscillations in the number of cases. San Patricio County has been going up and down with the weeks, with different days of the week. And so I don't see any reason for alarm here yet. Basically, you don't see too much of a pattern here because it's just basically a lot of noise where we have low levels of cases. And realize the numbers here. We're talking about 10, up to 10 new cases per day on average. And that's still not very much, just barely into the double digits. But that's not the case for all of Texas. And I think everybody's started to hear, we've been reporting for a few weeks now on this, but overall in Texas, the number of cases are going up, and they've been going up in Northwest Texas for quite some time now. And if you compare the peaks, South Texas, that's us, the big peak, the biggest peak on the graph. And if you look at Northwest Texas, Amarillo, the Amarillo region, the El Paso region, those peaks are headed straight for where we were over the summer. So that's not like a little outbreak, that's a big outbreak that's occurring in Northwest Texas right now. Dallas is starting to curve up. This shape on the graph here is steeper for Dallas now than it was in the past couple weeks. It's been trending upwards. You really need more data points to see if that's going to continue in that direction, but Dallas isn't nearly where Amarillo and El Paso and those parts of Texas are in terms of the average new cases per person over the past week. For the rest of Texas, it's not going up as much. So this statewide pattern of increase is being driven by these few places where there's really a huge amount of increase in Northwest Texas. Moving forward to the rankings, we're again from worst to first, so we are looking like the best trauma service area in the state, and that's why we're down at the bottom there. That's the least number of average cases per week. We hope that this continues. You can see El Paso and Lubbock right up there at the top. That's that Northwest Texas pattern. Amarillo and Wichita Falls not too far behind those. Getting into our percent positive tests, there is a development this week where for the public health department, their testing percentage has gone up to 25%. And I spoke to the public health director about this. And what was conveyed to me is that this is probably an effect of who's getting tested. They're doing a lot of contact tracing, connected possibly to the schools. And the people that they're testing have a fairly good probability of having COVID-19 after following up with the contact tracing. This type of testing and targeted testing isn't being done by other entities in the Coastal Bend area, so the mobile testing stations don't show that same increase. And overall, all of the tests in Nueces right now are coming back with a very low positivity rate of 2.8%, at least very low compared to where we were over the summer, where this blue metric was all the way up to 100% at one point. Moving forward with the hospitalizations, we're getting down to the bottom third of the state in terms of the average number of people in the hospital with COVID per capita on any one day. So that's a good development. There's a slow decline or even just a leveling off at this point. Here we're focusing in on the ICU COVID positive patients, and this week we're at 24. Last week when I presented, we were at 23. If you look at the red bars, you can see that for the past couple weeks, it's been fairly level. And so it doesn't look like it's really declining, just like for Nueces County, for the whole Coastal Bend, it has about the same pattern. And we're not quite down to that normal level in terms of number of patients in the ICU, and it's mainly because we're kind of hit this floor in terms of how many or how few people in the ICU we're going to have, and it looks like it's leveling off in the mid-20s as opposed to going down to near zero where we were before the summer. And if you look at this, we are trending in the right direction towards normality, but we're not quite there yet. For fatalities, we continue to rank fairly high, and I think this is an excellent opportunity to point out the lags that occur with COVID and when we start to see various patterns. The reason why we're so high ranked for fatalities is fatalities lag getting infected by so much. First you get infected, then you realize you're sick, then you get tested, then some people go to the hospital and some people die. And that could happen long after that initial infection. So that's why still the Coastal Bend is ranking fairly high in terms of the numbers of people dying per capita from COVID-19. I want to emphasize that these aren't people that had COVID and then died from something else. These are people where on the death certificate, the primary cause of death was COVID-19. Overall, there's been 700 people in the Coastal Bend area that have died from COVID-19. There's 600,000 people in the Coastal Bends. We're at 700 of those 600,000. The little inset graphic there shows you the overall trend where there's mainly a downwards trend, but there has been a little bit of an uptick in one of the surrounding counties. I believe that's Jim Wells. It's kind of small for me from here, but it's not a substantial uptick. I don't expect that that is going to continue given that we can see what happened with cases backwards through time. And this leveling off is a function of, one, the state doesn't count all the death certificates until at least 14 days after they've been filed. And so there is some expectation that this will increase more in this time period where we've kind of highlighted it here. But it is leveling off. The amount of fatalities is slowing down. Overall, here's our model of fatalities along with the actual numbers of fatalities per day with the points. And you can see that it's starting to level off. And if you look before Go to the other side of the graph, you'll see before the summer, right around June 1st, there were no fatalities. And now we're settling into this new normal where there's fatalities every day. And it doesn't look like it's going to stop anytime soon. And so this is something, one of the reasons why you're wearing a mask is so that we don't have to go through this again, have the fatalities jump up and have it take even longer to get back to where we were on June 1st, where there were no fatalities for at least a month before that and for several days after that also. Last but not least, we talk about the cell phone data because it tells us what could happen in the future. The things you're doing now and the way you're behaving can affect whether you get infected or not. And by looking at cell phone information, we can get an idea of how those rates of infection might change. The first one I'm going to show you is the essential and non-essential gatherings. Now, I think everybody's aware that the bars are opening up more now, and so we're pretty interested in what this looks like. You can see there's a very, very slight uptick in the amount of bar traffic if you look really closely, but really it's remained level. The reason that it seems that this is the case is because a lot of bars have figured out how to serve food also and remain open. And so there probably wasn't that much of an effect on foot traffic at bars, at least so far, due to the more open Texas phases that we've gone through now. Everything else here, gaming has come down, the movies have leveled off, and so there's nothing here that's really screaming at us that there's a big change afoot that we need to be concerned about. That's not the same for the school graphs. For the school foot traffic, there is a change afoot that should concern us, and that's this continued increase in the foot traffic in K through 12 schools. We know that this is happening because the schools are opening up and allowing more and more students in the classroom to go face-to-face, and we see that translate here on the cell phone graphic. And so as this level of foot traffic goes up, then the chances of transmission also increase. And we'll see if this levels off, but at least right now, it's on the upwards trend, and next week we'll see if that continues or not. So in summary, the transmission rate is between 0.9 and 1.1 right now by our best estimates. So it's somewhere between increasing and decreasing, but probably holding about steady. The new cases remain low locally, but they're increasing in Northwest Texas. The reason why that's so important, I know we're not in Northwest Texas, but they went through a summer spike too. And now they're in their next spike. They're in their fall spike already. So this could be something that we have to look forward to, and that's why we're wearing our masks. We want to try to avoid this. Hospitalizations and fatalities are leveling off. It doesn't look like in any time in the near future we're going to get back to the way it was before the outbreak at the beginning of the summer. And that's another reason why we want to continue to be vigilant. And the K through 12 foot traffic is increasing, and there may be some connection here to the percent positives that we're seeing at the Public Health Department. We're not completely sure about that yet, but it at least feels like there's a connection. And lastly, as occupancies rise, the weather cools, face coverings and social distancing become our primary way of combating COVID-19. And so it's more important now than it has been to keep wearing your mask, keep social distancing, to ensure that we don't get ourselves into another outbreak here. All right, thank you.
Las intervenciones no farmacéuticas continúan vigentes para seguir reduciendo el radio de transmisión del virus. Actualmente ese radio de transmisión es de 0.9 a 1.1, o sea que en promedio una persona enferma puede enfermar a otra con el virus. En el área de la costa se cuenta con 23.884 casos confirmados por el virus. 22.880 personas se han recuperado y alrededor de 304 casos continúan aún activos. En el área noroeste del estado, los casos han estado aumentando de manera significativa, mientras que nuestra área sigue experimentando un decline. Nuestra área, en cuanto a casos, ha mejorado. Somos el área con menor número de pacientes. Las hospitalizaciones se han mantenido casi sin cambios, mientras que en las unidades de cuidados intensivos casi ha llegado a un nivel normal. Actualmente, 700 personas han perdido la vida debido al virus. En el área de la costa se cuenta con una población de 600,000 residentes. Los fallecimientos también están declinando gradualmente. Con la reapertura de bares y restaurantes se han reportado un pequeño incremento en cuanto a la gente que acude a estos. Las escuelas están reportando un mayor número de estudiantes que están yendo a las escuelas en persona. Ahora más que nunca, con los cambios y reaperturas en algunos establecimientos, es mucho más importante seguir usando su cubrebocas y continuar practicando el distanciamiento social.
Okay, I think we're going to field some questions from Facebook Live.
I'm Tiffany Anderson. I'm here with the Coastal Bend Joint COVID-19 Task Force. Do you have any theories as to why Northwest Texas is spiking?
Well, I think it seems pretty obvious that as the weather cools down, there's a seasonal effect of COVID. This has been confirmed by authorities like the University of Washington's IHME Modeling Center. And it's the most northern part of Texas. It's going to be the coolest part. It's probably, it's come into the flu season, if you will, up there, and transmission has increased just because of the change in the weather. Beyond that, that's coincided with all these rolling back of restrictions on occupancies and face-to-face schooling and things like that. And those things combined with COVID is here, COVID's in the community, it hasn't disappeared, it's there in Northwest Texas. It's very easy for it to take off again, just like it did here over the summer. And once it starts taking off, it's very hard to slow it down.
Do you have any ideas as to why we're not seeing a spike locally right now?
Well, it's a good question. I have my ideas about it, and these are just my ideas, not of the task force, but we saw an unexplainable drop in the transmission rate going from spring to summer. And it seems like that could be happening again in the fall time now. And if we get into more of our winter weather, it's possible that that could lead to an increased transmission rate and coincide with a greater spread of the virus. So that's sort of an educated conjecture at this point based on tracking this as closely as we have. And that combined with maybe people here are a little bit more vigilant, that's possible also. But ultimately, time will tell. I mean, if you look at it, there's a clear geographic pattern across the United States, not just in Texas, where the farther north you go, the more COVID is taking off. So it looks like the public health director wants to jump in here.
And I'm going to agree with what Dr. Bird just said, but the question came up about like in West Texas. I know for Lubbock, the university's reopening has caused some of that spike, as well as reopening Texas. So there's a combination, the weather as well, as mentioned. And so there's all these factors that we're constantly looking at, because they usually get flu, and this is COVID, which is a coronavirus, but they usually get flu before we do. And we look very closely at Dallas and at Austin and at San Antonio. So, but what was interesting, the last spike was that we actually had the valley that was actually getting higher numbers sooner than we did, because it usually goes north to south. And so it almost was like we were at every border, we had cases around us. So we knew it was just a matter of time. I am hearing that people are wanting to still, because of pandemic fatigue, they're wanting to travel to the beaches or to Corpus or to just to get away, to come out here. And so again, when you start seeing those type of traveling events and you don't have solidarity, then you start seeing spikes, just everywhere. And so that's what we're looking for. But I also think that when I'm out, that I see people wearing masks. So I believe that they are being more vigilant. And so I'm very appreciative to the community for that. And I think sometimes people's masks fall below their nose, and it's just that you get to be in a hurry. And so just reminding people to keep those masks and covering your nose and mouth is also very helpful, especially while we're in flu season.
And I'll just follow up, it's not just the weather, it's how much you're inside. And so this summer pattern where the farther south you went, the stronger the COVID was probably at least very partially driven by how often you want to be inside because it's so hot outside. and that's probably why we took the brunt of it over the summer. And I'll reiterate that basically science doesn't understand why there's seasonality in the flu. There's no one solution to that. It hasn't been figured out yet, and probably the same sorts of things that drive seasonality in the flu are driving seasonality in COVID. And so if they haven't solved it in the flu, there's only so much we're going to be able to do here with COVID.
Okay, thank you.
Thank you. Are there any other questions? So seeing no questions from the media, thank you very much for being with us here today, and we will have another press conference next Tuesday, 5 o'clock. Thank you.